Welcome to another edition of the Ministry of Health's Health Matter on television and our Facebook page. I'm glad that you could be with us. I've got in our studio today Dr. Tariq Jagnarine. He is a program manager of the National AIDS Program Secretariat, and Miss Deborah Success. She is the coordinator, VCT, Voluntary Counseling and Testing Coordinator, attached to the ministry. They've got an interesting activity coming up this weekend, and we're going to hear more about it. I am Nazim Hussain. Glad that you can be with our program today. Dr. Jagnarine, Ms. Success, welcome to our program. Dr. Jagnarine, I'll start with you first of all. We have all been consumed and smothered with COVID, and one gets the impression as HIV has gone away. But it's not so. Your team of the National AIDS Program, has been working very hard with a number of activities. But give us a little rundown of what's been happening and new developments at the National AIDS Program.
Thank you, Nazim. And first of all, thank you for having us here. 2021 has been quite a successful year for us, but of course there were some challenges due to COVID. There are many new activities we rolled out, such as our PrEP services, pre-exposure prophylaxis for persons who may be at high risk based on sexual behaviors. They can access antiretroviral treatment that prevent them from getting HIV. For 2022, we have quite a lot to focus on, especially expanding the PrEP services towards other sites. 2021, we started 15 sites. So in this year, we're hoping that we can take it to all the care and treatment sites throughout Guyana. At the same time, we would have started our pilot for the HIV Self-Testing at 4 sites in Guyana, started this year, early January. We're looking at sites such as the National Care and Treatment Center, Campbellville Health Center, GRPA, as well as the Midway Clinic. Added to that, based on evidence we're seeing coming out from our recently concluded behavioral biological surveillance survey, we know there's an increase in sexually transmitted infections. And so we're ramping up our services as it has to do with STIs. All of our 50 VCT sites, and we want more, of course, this year. We're hoping to take on 7. We're hoping they do not only HIV testing, but testing for STIs as well. Hepatitis C also is one of those areas that has been put on the back burner for quite some time. In Guyana, a lot hasn't been done in Hep C, especially with HIV patients. And so we're trying to prioritize Hep C in terms of having guidelines, treatment as well. The treatment for Hep C right now, we have the cure. You can just take about a 3-month treatment and you eliminate Hep C. Besides that, we want to revise our condom strategy, our behavioral strategy. We want to focus a lot more on areas that has to do with gender-based violence, stigma and discrimination, in order to have more of a balanced program. Adolescents too, as you mentioned, COVID would have resulted in many other illnesses being pushed in the back of focus. And so you have a lot of adolescents who are not taking the vaccine, they're not accessing services for condoms, for testing, and so we're trying to focus a lot on them.
But very quickly, I just want to take you back for those people who might be thinking that this PrEP is something new. If you could just walk us through, how can someone access the service?
So PrEP is not new. It's a best practice that has been done throughout the world. Many other countries, Botswana, Kenya, these countries, they actually started PrEP, they've perfected PrEP, and the research is there that shows that it's effective. And so in Guyana, if persons feel that they are involved in high risky sexual behaviors, having multiple partners, they would have had frequent STI during a given year, they may be involved in unprotected sexual activity, they may have especially key populations that we focus on, such as men who have sex with men, female sex workers, transgender population. These persons can go to one of the PrEP sites, and of course we're trying to expand that to all the sites in Guyana and have this treatment. When they go, some of the things we do, we do a little bit interview. Of course, we have to do HIV test.
But most importantly, this will be negative people. People are negative.
Yes, that's what I'm about to tell you. We have a test first you have to do is your HIV test. Once you're negative, you can access that. If you're positive, we link you to our care and treatment center.
Mm-hmm. So, and this is open you mentioned some population, but this is open to all Guyanese.
It's open to all
Once you're
Guyanese.
in that category or
Once
in
you're in that
high-risk
category.
activities.
And the good thing about it too, we're not only offering it to all Guyanese, but we offer two versions of it. Continuous PrEP, if you think you continually involved in risky sexual behaviors. And then we have event-driven PrEP. If for some reason at a given moment you felt you're exposed, or you're going to be exposed based on an activity you're about to do, you can access the PrEP services.
Big question somebody's asking at the moment. How much do I pay for this?
Nazim, I'm happy to tell you, like everything else when it comes to healthcare in Guyana, it's free. Free of cost.
Okay, we'll take a break. We have much more to offer you with the National AIDS Program Secretariat. They have a great activity coming up this weekend. Test of Love, HIV testing. We'll learn more about that. Don't go away. We'll be right back.
HIV Self-Testing is a new initiative being implemented by the Guyana government and other governments in the Caribbean. It provides a way for persons to know their HIV status by using a test kit in the privacy of their homes or offices. We need HIV self-testing in Guyana and the Caribbean because many of us are not going to the clinics to get tested. Knowing your HIV status is the best thing you can do to help end AIDS. NGOs like SASAD Guyana can help with HIV self-testing by providing counseling before and after you take the test. You don't even need to come to our office if you don't want to. You can simply call us and we can counsel you over the phone. This is a role we can play when the government of Guyana rolls out HIV self-testing. But don't wait. If you don't know your HIV status, get tested like yesterday.
It's time for a policy on HIV self-testing.
Welcome back to our program. Glad that you're still with us. Dr. Jagnarine, you had mentioned again in your capsule of activities last year for the National AIDS Program, and you mentioned self-testing. And again, for some persons who are in June right now, they might think this is something new. Tell us, what is it? We know VCT, you go, you meet someone, and you tell them your story, you got tested, and something happened. What is self-testing all about?
So one of the things about self-testing is the fact that you can actually do a HIV test at the convenience of your home. If anything, COVID-19 has taught us, and as you are aware, the CDC has approved persons that they can do testing at home. It's a similar approach we're going to be trying with HIV self-testing. If you feel that you have to do a test because you would have been exposed for some reason or whatever reason you feel, you can take a test at home, have it done, but of course this is done with guidance. You're gonna be having counseling before you get the test, during the test, and even after. These tests, they're not standalone. We link you directly with follow-up with one of our sites to have an additional HIV test done to confirm. We would link you with treatment. So we're at the phase currently with the National AIDS Program. We're developing the policy that relates to that, the guidelines. We want to ensure we get it right. We're not going to expand too rashly. We're going to start off in high prevalent areas, especially region 4. And then from there, once we can see what are the challenges that we experience, we'll try to, of course, mitigate them and then expand to other areas.
The success, this is your field because you're the VCT coordinator, voluntary counseling and testing coordinator. Testing come under your mandate. Tell us, somebody out there who might want to venture into this, what will they do? Just walk us through.
Okay. Well, the self-testing, it's a new initiative for Guyana. But as Doctor said, it's not new globally, but for Guyana, it's new. And persons can have a test done, at their own comfort. Many persons...
But they will have to go somewhere to access the kit.
Yes.
Right.
Right? The kits will be available we're looking to engage like pharmacies, civil society, and
even the VCT
even
sites.
the VCT sites.
Right.
And one of the good things is that this test can be done either assisted by a counsel tester, the client can be assisted and guided, or the client will be given all the necessary information and they can do the test themselves. The test that will be used is the oral quick, and that has directions and everything that you can follow.
And that's a swab. That's not
No,
the finger
it
prick.
has, no, that's a swab. It's
Right.
a oral, it's mouth swab where you swab the mouth. But all directions from step 1 is there. So the counselor will give you all the necessary information, and then if you feel comfortable, you can have it done. But before that is done, there will be an app that the client will be required to answer a few personal questions. At the conclusion, the app will indicate to you whether you're a candidate to have the test done by yourself, or it will be recommended that you do it under the supervision of a trained and certified counselor tester. However, it must be remembered, person must be reminded that the results of that test, that first step, is preliminary. If the test is HIV positive, then that client will be directed to a health center or hospital where they will be in communication with a trained healthcare provider who will provide all the necessary information and guidance for them. So the self-testing must have a confirmatory test.
Is there any new updates for the regular VCT that we would have known over the years, or that still continue?
Oh, the regular VCC still continue, but there are several persons who are always debating among themselves whether they should go, whether it's confidential. You know, these irrational thoughts come to them, so they will be given the opportunity to have a test done in their own comfort. There's another opportunity that if we're a couple, we can talk about it, we can discuss it, and we can have the test done together.
Yeah, true.
You know, because one of the things that are absent from many relationships, persons fail to ascertain what they're bringing into a relationship. So you start a relationship without having a test done to know what you have, you know, and you may probably start the relationship by commencing by using a condom, and then after a few mornings you get comfortable. When the condom disappears, you don't even know. Right? So couples can have it done together.
Jagnarine, you had mentioned something we don't get to talk about, and that's his other sexually transmitted diseases. And you singled out Hep C, hepatitis C. Can you elaborate a bit about that? And if the NAPS is also looking at other STIs?
Most definitely, Nazim. You see, one of the thing is, and I want to, in all our language to bring out, is that we're not just focusing on HIV. We're also focusing on HIV and other sexually transmitted infections. And based on our evidence that we're getting is that there is this huge rise, especially in syphilis, hepatitis B, and gonorrhea. And not forgetting there's Hep C, which not much has been done. In terms of Hep C, you have most persons will be screened for Hep C only when they do a blood transfusion, and so they're not really linked towards treatment. In Guyana, there's no current treatment for Hep C. Persons live with it for years, and of course, it's transmitted through the same means, just like HIV and other STIs. And so, what we want to do is now develop our new guidelines and have the tests available. These testing for STIs, I'm happy to say, we're not centralizing it. Almost all of our 50 VCT sites, you can go and not only have a HIV test done, but you can have an STI test done. Syphilis, gonorrhea, chlamydia, hepatitis B. And so now by trying to get the kits, we're going to be having hepatitis C. It's going to be a little work in progress because, of course, since it's something new, a new focus, we have to have proper guidelines in place, testing algorithms, policy, treatment protocols. But the main goal about it is that Hep C cases happens to be at least 4 times greater than HIV cases. Worldwide, there are about 37.5 million HIV cases. But you may be surprised to know there are over 170 million hepatitis cases. And so it means that there are persons in Guyana who may have hepatitis C and they're unaware. And so our job now is to not only bring the testing to you, but ensure there's treatment available.
All of this, you know, HIV testing, STI testing, obviously you're going to get numbers, people who are positive. And so someone, again, listening or viewing would say, well, where is the treatment? Where is the care? Do we have that? Is that reliable?
So we are actually in the process of 2022 procuring the kits as well as the treatment. One of the things I want to mention about the treatment is years ago, persons would have had to be on treatment for months, going on to years for Hep C. And sometimes they always didn't get success. They had to keep taking that treatment because when they test back, it's still there. Now with the new line treatment that we're going to be bringing in for 2022, you can actually be on the treatment for just about 2 to 3 months and then you're cured. It's going to be at all our care and treatment sites. And one of the things we're going to be focusing on as the HIV program is to slowly take care and treatment to most of the health centers. Because gone are the days where we look at HIV as just an infection. It's a chronic disease.
Yeah.
But it's manageable. It's not a life sentence. There are great treatments out there for HIV, for the STIs. And so we want everyone, wherever you are, to access the care at your convenience. And so that's why we're trying to bring quality care towards you as the people.
And I'm absolutely sure, Ms. Success, that all this information is given at the point of testing.
Oh yes.
Yes.
Oh yes.
Yes.
Oh yes.
To reassure the clients or patients that these services, these treatments are available.
Yes. Since the beginning of 2021, we have introduced a more comprehensive service. So every client who are accessing HIV will also be given, once they're desirous, the syphilis and the hepatitis B, test. They will be provided with the necessary counseling and referral if there's a need for them to be referred to the National Care and Treatment Center for further management.
Dr. Jagnarine, they've got an influx of people from Venezuela, Brazil, Cuba, and I'm quite sure these people would also want to access services. Is that being encouraged? And do we have people in place who can accommodate, especially the Venezuelans?
Most definitely. We recognize this as a trend, and we realize that with this new influx of persons come specific illness they may present with, specific challenges. And so we've started implementing measures so that they can be tested. And not only tested, we're providing packages of service for them.
Yeah.
Hampers, testing, linkages specifically to center if you need counseling, if you need additional treatment. And we're doing it in your native language. If you're speaking Spanish, you're able to get everything done. You sit with a Spanish-speaking tester, doctor. We link it with Portuguese. We give you all the necessary advocacy materials in those languages. And so we can't neglect one set of population and focus on the others. And so we're trying to take it to everyone. In fact, we even start considering that population, which we refer to as migrants, as a key and essential population to focus because the numbers are increasing daily.
Yeah.
And just to add to that, Nazim, we have started taking the services to the population. So if they're experiencing any difficulty in accessing the service, we take the service to them.
Right. When we come back, we will wrap up, but we will be finding out about activities on this weekend, as many of you out there will be observing St. Valentine's Day on Monday coming. The NAPS is going to be working on the weekend. Don't go away.
Preventing HIV and having safe and healthy relationships are an important part of sexual health. We'll take you through an overview of PrEP with PrEP 101, show you how to access PrEP, and let you find out if PrEP is right for you. PrEP is an HIV prevention option that works by taking one pill every day. PrEP stands for Pre-Exposure Prophylaxis. When taken every day, PrEP can provide a high level of protection against HIV and is even more effective when it is combined with condoms and other prevention tools. People who use PrEP should take the medicine every day and return to their healthcare provider every 3 months for follow-up and prescription refills. Now, let's take a look at the numbers. In several studies of PrEP, the risk of getting HIV infection was up to 92% lower for those who took the medicines consistently than for those who didn't take the pill. Some people in clinical studies of PrEP had early side effects such as upset stomach, loss of appetite, or mild headache, but these were all mild and usually went away in the first month. How do you start PrEP? Talk with your doctor or healthcare provider. If you and your provider agree that PrEP might help, get tested for HIV and other sexually transmitted diseases, and to see if your kidneys are working well. If PrEP is a good option for you, your provider will give you a prescription. PrEP is covered by most insurance programs. If you don't have insurance, your healthcare provider can direct you to medication assistance programs that may help pay for PrEP. You can also contact your local health department and HIV and AIDS service organizations for more information. Thinking about PrEP to prevent HIV? Here's what to do next. Make a list of why you think PrEP would be right for you, and do your research and seek out information to help you decide. Also, think about your routine and what might make it easy or hard to take a daily pill. And always know you can call your healthcare provider if you have more questions. But what are the best questions to ask? Would PrEP be a good option for me? How much would PrEP lower my risk of HIV infection? What else can I do to lower my risk of HIV infection? Can I get help paying for PrEP? Are there any side effects to PrEP? How often will I be tested for HIV and other STDs? Will you prescribe and manage PrEP for me? If you decide PrEP is right for you, definitely take your pill every day. Follow your healthcare provider's advice about how to take your pill. This will give it the best chance to prevent HIV infection. Tell your healthcare provider if you have trouble remembering to take your pill or want to stop PrEP. Remember, you are in control. Get informed. Make the right choice for you. Check out the Start Talking, Stop HIV website for resources.
Glad that you're still with us on the Health Matters. Let me begin with success here. Over the years, NAPT have always had activities to, showcase its work in the fields, National Week of Testing, Regional Day of Testing, and of course, one that's been going around for a good while, Test of Love. Tell us a bit about that and what's happening this year.
Okay, so the Test of Love in observance of the St. Valentine's Day will be conducted again this year. The focus is on couples. It's a Valentine's Day couples testing activity. However, it does not mean that if some single person is desirous of accessing the test, they will be refused. But focuses on that couple getting tested together as a demonstration of their love and commitment towards that relationship. So we begin this year on Saturday, the 12th of February, and we will be at the Monrepo Market Square. We will be at the Giftland Mall and at the City Mall on Saturday. Testing and the same comprehensive service will be offered. We also have prevention tools, condoms, lubricants, brochures that will be distributed to persons. So anyone out there, feel free to come access condoms and lubricants. It will be there for distribution, free of cost. On the 13th
And if people just want information, nobody want to be tested, but they
No,
want
that
to speak to someone.
that will be provided.
All right.
We have our counselors, we have our doctors.
You're ready.
It's a holistic approach, and so everybody is involved. And so if you don't feel like getting tested, you want the information, it will be provided. We have persons on the ground who will be providing that service.
So Saturday again, remind us on Saturday, the venues.
Saturday will be Monrepo Market Square, Giftland Mall, and the City Mall at Regent and Camp.
Right.
We
Sunday
will
night.
also have peer educators
Right.
who will be on the ground distributing, educating persons, distributing condoms, and directing persons where they can access the service. We have banners that will be mounted so persons can see and feel free to access the service. On Sunday the 13th, we will be at the Porica Market Junction. And in the afternoons, we will be at Georgetown Seawall. And there, the service will be provided. Condoms, lubricants, and everything will be distributed free of cost. On Monday, that's St. Valentine's Day, we will be by the Demico House car park, and that's in Region 4. In addition to all the other VCT testing sites will be operational, we'll also be in Region 7, Hope Foundation, Bartica. We'll be in Region 10 with the For the Children's Sake Foundation. And we also will have a mobile service from the 10th to the 14th to different communities, Region 3, Region 5, between Region 3, Region 4, Region 5. We'll be working in areas where we found from our programmatic data that it yields a lot of positives. So we will be taking the service to those persons and they can access it.
Mr. Sachs, what about some of the, I know the NAPS is there, always providing services also and products. The people who want the condoms, people from various, workplaces and so forth, how can they do that? Who can come to collect condoms?
Anybody can come to collect condoms. Any organization, you can access condoms at the National AIDS Program Secretariat, at the health centers. We're free, of course, and we're in the process of taking condoms to the hotels, barbershops, salons,
or those who you don't know, they could come to the
and
NAPS and
those,
collect.
right.
All
They
right.
can come and have the condoms free, of course.
Mm-hmm.
Condoms is our prevention tool, so persons must feel free to come to the service and access it.
Condoms, brochures, lubricants.
Guns.
We
And you have
enough.
both male and female condoms.
Both.
Oh,
male
yes,
and
both
female.
male and female
Yes.
condoms.
Dr. Jagnarine, as we wrap up, and then we just got 60 seconds more, what would you want to tell the listening public to expect in 2022 as we move forward in a year that, it seems to be rapid development in our country?
Definitely. So in 2022, some of the things we want to implement are more focus on sustainability. A lot of focus is going to be ramped up on the prevention, ensuring that we don't get the illness, period. And once we can actually control persons from not getting it, I think we're heading in a good way towards elimination. And so we want to have better condom strategies, more behavioral changes, especially in our adolescent population, the way they perceive sex, the way they approach sex. And then at the same time, of course, focusing on other STIs that may have been neglected. At the end of the day, we want to ensure that we can not only better control the HIV epidemic, but we want to focus on STIs. And at the same time, ensure persons are linked to proper care. The care must be in place for people so they can get treatment.
Dr. Jagnarine, Ms. Success, thanks for being on our program. This has been Health Matters. Glad that you could be with us in today's program. Do join us again next time. And until that time, stay safe.